Hi, and good morning. This is Dr. Cary Ganz, and I'm here in my office in Garden City, waiting for my first patient. So I thought I'd talk to you a little bit today about new technology in dentistry and how does it benefit you, the patient. Because at the end of the day, that's really what's important. Well, there are two technologies we use here in our office in Garden City that I believe are very important and tend to find dental problems before they become big problems. You know, like anything else in life, it's a lot easier to solve small problems than it is to solve big problems. So the sooner we find something, the sooner we find an issue, the easier it is to resolve, the less costly, less time it takes, etc. So let me talk to you today about two different tools we use. One is called diagnodent. Now, the diagnodent basically uses a non-invasive red laser. It's just like a laser pointer. And what it's used to do is to find decay where previously we just couldn't find it. We'd have to wait till the decay was deeper, bigger, darker, showed up on an x-ray, and by that time it's more difficult to treat. It's bigger, and the bigger, the more difficult it is to treat. Well, with diagnodent, we can find decay that is very, very tiny. Very often the fillings that we do can be done without anesthesia. They're very inexpensive, they take no time, and much easier on you. Once again, the sooner we find those areas of decay, the better off you are, and the easier it is to treat. Now, most of the time when you go to the dentist, he's going to take an Explorer, the instrument with the sharp point on it that everybody hates, and poke around your tooth, and they'll try to find areas where that Explorer sticks, where it goes in the little grooves on your teeth, and that Explorer sticks in those grooves. And then we assume because it sticks that there's decay there. And the reason is that when teeth form, they form in lobes. And those lobes are supposed to fuse, but very often they don't. And that's an area where decay starts. So that's why we use the Explorer to go ahead and find those areas. Well, the Explorer is pretty thick compared to those little grooves, and very often the decay starts below those grooves and the Explorer doesn't find it. So we use diagnodent. Once again, it's a computerized tool. It shows us where decay is at a much smaller level. And it's non-invasive. There's no pain from it. There's no discomfort. It's not radiation. It's not like taking an x-ray. There's no downside to it. It's just a great tool to help us find decay at an early level. The other tool we use is something called the transilluminator. Now, what does this do? Well, a transilluminator is basically like a flashlight. It uses a specific wavelength of light. It's very bright. Once again, totally painless, non-invasive, doesn't hurt. And what we do is we shine it on the tooth. When the light hits an area of air, AIR, the light is reflected back, and on the opposite side of that air, it looks dark. So if you have a crack in your tooth, and you shine the light and it hits that crack, the light doesn't penetrate that crack because there's air in that crack, and we see darkness on the opposite side. That means that we can see a crack in your tooth before it shows up on an x-ray and before you break your tooth. You see, right now, a lot of people find that they're breaking teeth for a variety of reasons. Sometimes it's a habit. People chew on ice and pencils and all kinds of crazy stuff. Another thing is that people have had silver fillings in their mouth for years. Those silver fillings very often have undermined tooth structure, or the silver expands and contracts and eventually puts little cracks in teeth. Now, once again, if we find those cracks soon enough, we can go in there and do a minimal restoration. If we wait until those cracks get larger or the tooth fractures, then we go ahead and we have to go ahead, restorations become larger. Then you're talking inlays, you're talking crowns or whatever, or possible loss of a tooth. If that crack goes unnoticed and eventually it breaks the tooth in half, or a large piece of the tooth comes off, and many of you have experienced that. You've experienced biting into something and a piece of your tooth cracks off. Well, if that was found sooner, maybe that could have been avoided. So those are just two tools, and we'll go into others as time goes on. I don't like to keep these things too long, but those are just two of the tools we use here in our office, and many dentists around the country are using, and you should ask. Sometimes they're doing it and you don't even realize they're doing it, but you should ask your dentist, do they have diagnodent, and do they use a transilluminator? They may not even know it exists, and if they don't, it's a tool that may help them in their practice, and it may help you as well. So if you're a dental patient, and you're interested, give us a call. If you live here on Long Island and you'd like to come in and chat and see what kind of office we have, we're here in right across from Neiman Marcus in Garden City, New York, right across from Roosevelt Field. And you can always reach us at 516-741-1230. If you're a dentist and you're interested in these technologies, I don't sell them, but I'll be happy to chat with you and give you some information. They're two great tools, and they're things that you can use in your office to help your patients. Now, there are a couple of people on, so I'm going to wait and see if you have any comments or any questions about these two tools. And as with most things, it's just important to understand as a patient that you need to get to the office on a routine basis. You need to see your dentist at least twice a year. We try to see our patients 3 to 4 times a year, just to make sure these little problems don't become big problems. We also want to make sure that there's no bacteria on your teeth. We want to make sure your teeth are clean. Now, the worst word you ever used in dentistry was the word cleaning, and it's been used for a million years. Don't know where it started, but the reality is, at the end of the day, we're not cleaning your teeth. It's not like cleaning your house or cleaning your car that can be put off till tomorrow. It's necessary to get bacteria off your teeth. It is common knowledge today that the bacteria in your mouth, the bacteria that accumulate on your teeth, are a causal agent for such things as diabetes, heart attacks, strokes, all kinds of cancers. This is not something that we should be taking lightly. It's not just a cleaning. So that if I don't go today, if I cancel the appointment, it's not a big deal. I'll get my teeth cleaned next week or next month or next year. Not the case. You really need to get in and get your teeth taken care of. And an early treatment on all of this, getting your teeth cleaned every 3 times a year, 4 times a year, using the tools that we mentioned today, diagnodent and transillumination. Good x-rays, digital x-rays, so we can see what's going on, can go a long way in keeping your teeth for the rest of your life. There really is no reason today to ever lose your teeth. Now, accidents happen, things happen, but for the most part, there's no need to lose teeth anymore. In a future video, we will talk about how you can restore teeth and what the options are. We'll talk about crowns and bridges and implants and things as time goes on. We try to do these things once a day, or depends on when I have time to do it. And in the future, we'll try to let everybody know when we're doing it so you can be there. Right now, my name is Dr. Cary Ganz, and I want to wish you a great day. Go out and have a great day, and we'll talk to you real soon.